Question number 1. Which of the following is the most common cause of male infertility? The correct option is B. Varicocele. Question number 2. Which of the following infections can lead to male infertility? The correct option is D. Mumps or orchitis. Question number 3. Oligospermia is defined as sperm concentration lower than. The correct option is B. 15 million per milliliter. Question number 4. Which of the following is a cause of immune-mediated infertility? The correct option is D. Anti-sperm antibodies. Question number 5. What is the most severe form of male infertility? The correct option is A. Azoospermia. Question number 6. Which supplement is beneficial for improving sperm quality? The correct option is D. Vitamin C and E. Question number 7. Which test is used to assess DNA fragmentation in sperm? The correct option is A. Tunnel assay. Question number 8. A male with bilateral undescended testes at increased risk of. The correct option is D. All of the above. Question number 9. Which antioxidant is most beneficial for sperm motility? The correct option is B. Coenzyme Q10. Question number 10. Varicocele repair is most effective in men with. The correct option is A. Normal FSH. Question number 11. Which imaging techniques is not commonly used for male infertility assessment? The correct option is B. X-ray. Question number 12. The primary test for evaluating male infertility is. The correct option is C. Semen analysis. Question number 13. Which vitamin deficiency is associated with poor sperm quality? The correct option is C. Vitamin D. Question number 14. What is the normal semen volume per ejaculation? The correct option is C. 1.5 to 5 ml. Question number 15. Vasectomy reversal success is highest within. The correct option is B. 5 years. Question number 16. Which imaging modality is best for diagnosing varicocele? The correct option is D. Doppler ultrasound. Question number 17. The ideal duration of abstention before semen analysis is. The correct option is B. 2 to 7 days. Question number 18. Which hormone is essential for spermatogenesis? The correct option is B. Testosterone. Question number 19. What is the normal pH range of semen? The correct option is C. 7.2 to 8. Question number 20. The absence of weight difference is a characteristic of which genetic disorder? The correct option is a cystic fibrosis. Question number 21. What is the normal sperm motility percentage required for fertility? The correct option is B, greater or equal than 40%. Question number 22. Y chromosome microdeletion can result in? The correct option is A, azoospermia. Question number 23. The most common congenital cause of male infertility is? The correct option is D, Klinefelter syndrome. Question number 24. Which of the following medication can cause male infertility? The correct option is D, chemotherapy drugs. Question number 25. The normal sperm viability percentage should be? The correct option is C, greater than 50%. Question number 26. The hormone responsible for initiating spermatogenesis is? The correct option is B, FSH. Question number 27. Which of the following condition is not associated with male infertility? The correct option is D, psoriasis. Question number 28. What is the most common cause of secondary testicular failure? The correct option is A, pituitary dysfunction. Question number 29. The most effective treatment for severe male factor infertility is? The correct option is C, ICSI. Question number 30. Artificial spermatozoa generation is an experimental approach for? The correct option is D, non-obstructive azoospermia. Question number 31. Which experimental therapy is being investigated for genetic infertility? The correct option is A, CRISPR, gene editing.